So we're looking at another basis of diagnosing cancers. Let me say, if I'm suspecting, all right, that a cancer is actually here, all right, there are some 1 or 2 tests that I can do to pick up some 1 or 2 things that I know that they will usually rise if the cancer is there. So that's what they call a tumor marker. So panel is like, for this type of cancer, this type of thing should be risen. Do you understand? So the tumor marker panel is just, for the different types of things that usually rise in different type of cancers. Do you understand? So of course, for this particular cancer, these particular things will rise up. Do you understand? But just want to look at common things that we'll actually look out for in different types of cancers. So they are just a set of laboratory tools. So they measure specific substances. So these substances, they are called tumor markers. You understand? So it's the tumor markers that will usually rise up when a particular cancer is present in the body. Do you understand? So to help the doctor to be able to dictate, to be able to monitor the type of cancer, and to be able to diagnose the type of cancer. So what they do is they aid you in diagnosis, they aid you to monitor treatment, they aid you to dictate if a particular cancer has a risk of actually coming back to the patient. Like they are treating a patient, the tumor marker is going down, then all of a sudden it's rising up. Of course, it's telling you that the cancer is likely to come back. Then also guides therapy. All right. So examples of tumor markers, you can see them. All right. Different colors and the keys here. All right. Like let me see forward. Okay, glioblastoma multiforme. Let's just talk about this. So things like alpha fetoprotein, they usually rise up in liver cancers, ovarian cancers, germ cell tumors. Things like carcinoma embryonic antigens will rise up in colorectal cancers, pancreatic cancers, lung cancers. Then carbohydrate antigen will rise up in ovarian cancer. That's the antigen 125. Then 19-9 pancreatic and bile stomach cancers. Then the carbohydrate antigen 15-3 will rise up in breast cancers. Prostate-specific antigens will rise up in prostate cancer. Human chorionic gonadotropin will rise up in testicular cancers, ovarian cancers. Beta-2 microglobulin in multiple myeloma and lymphoma. Alright. Then thyroglobulin is in thyroid cancers. Squamous cell carcinoma antigens, squamous cells of the cervix, okay, the head and neck. You understand? So how they are used, some of them, just one of it can actually be used to diagnose a cancer. That's one of its rise up. You see that, okay, this cancer exists. Sometimes they have to do it many tests for many of them. So many of them must be risen up for you to actually establish that the cancer is actually present. Then it's not only them you use, you can still do other tests like biopsies, where you now cut the tissues, send it to the lab to have a definitive diagnosis and all, and also staging. Okay, so that's it for tumor marker panel.